Now I am going to discuss arthritis in SLE. When you have a patient with joint pain, try to evaluate joint pain in the following orders. Number 1. Is there arthralgia or arthritis? Number 2. Is it inflammatory or non-inflammatory? Number 3. Unilateral or bilateral or combined? Number 4. Symmetrical or asymmetrical? Number 5. Mono or oligo or polyarthritis? Number 6. Upper limb involvement, lower limb involvement or combined. Number 7. Is it involving small joints or large joints or combined? Number 8. Is it erosive or non-erosive in character? And lastly, number 9. Is it deforming or non-deforming? You can get SLE type of arthritis in so many conditions like in Sjogren's, polymyositis, dermatomyositis, sarcoidosis, even in many cases of vasculitis. But always try to evaluate the joint pain in those following 9 points I have already told you. Okay, so now coming to the SLE type of arthritis, we have arthralgia. Patient is going to complain of pain, a lot of pain. Arthralgia is very prominent symptom with or without presence of arthritis. Okay, so arthralgia will be very prominent. Number 2, it is an inflammatory condition. Number 3, it is bilateral. Number 4, it is symmetrical. Number 5, it will be involving many joints, so it will be polyarthritis. Number 6, it will predominantly involve upper limb, joints of upper limb. Number 7, small joints will be involved. Number 8, one of the very important feature of SLE arthritis that it is non-erosive in character. Okay, the moment you see erosion, it is RA, rheumatoid arthritis. Okay, if you see erosion in SLE, it is called rupus, rheumatoid arthritis with SLE, and you have to carry out one investigation, and that is anti-CCP. Okay, you have to look for anti-CCP. So SLE arthritis is usually non-erosive. If you see erosion, you have to carry out anti-CCP, and it will be called rupus, rheumatoid arthritis with SLE. And number 9, it will be deforming. It will be deforming arthropathy. Now, deforming arthropathy, also called Jacquard arthropathy, it was first discovered in acute rheumatic fever, but may be called in other conditions. Okay, so let's combine the entire points about arthritis in SLE. Number 1, there will be arthralgia. Number 2, it is inflammatory. 3, bilateral. Number 4, symmetrical. Number 5, polyarthritis. Number 6, it will involve predominantly upper limb. Number 7, small joints. Number 8, non-erosive. And number 9 may be deformed. Okay, now I have one question for you. Suppose a patient of SLE who was on steroids comes to you with one joint swollen out of proportion without any new skin lesions or any other joint involvement. Okay, the patient is complaining of pain and swelling of one joint swollen out of proportion than other joints without any new skin lesions or any features of flare. Okay, so what will be your diagnosis? Yes, it is always septic arthritis. You have to consider this. Now I have another question for it. Suppose a patient of SLE on steroids comes to you after 3 months with sudden onset of pain in one joint, say hip joint. Okay, uh, now what will be your diagnosis? Yes, because patient was on steroid for 3 months, so there will be a high possibility of avascular necrosis of neck of femur, and you have to carry out an urgent MRI for the condition to rule out. Okay, so I have already told you about the characteristics of arthritis in SLE. Thank you.